I also worked in the Sentinel trauma ward for 3 years.
Okay.
I volunteered and followed. I watched 3 open heart surgeries, learned to suture. So I took it to another level. So I'm aware. I still have my HIPAA. I can go to any hospital, Sentinel. I can go to any hospital here because I still have HIPAA. I can still look at medical records because it hasn't transpired. Because I was changing bedpans, and we have people that call frequent flyers that will come in Sentinel. The frequent flyers are like the older people. That are not eating, don't have any really support, Social Security or Medicare. So at a certain time, they know to call 911. And the paramedics will bring them in, like say 10 a.m. So they know exactly at 12.
They get lunch.
They get lunch. And if they pretend that they're really sick, then they stay there and get dinner. We had one frequent flyer, this older woman come in earlier that day. I was working there on the weekend, like a Saturday, summer. She came in early that day, and I was hip to who she was and what she did, and how she did it. And we took care of her, and she was released. Nothing was wrong with her. She was released. Came in later on that evening, and as they were rolling her in, she looked up at me and looked up at the doctor that I was shadowing, and she said, "I told you not to bring me back to this house. I wanted you to bring me to downtown."
They done messed up a scam, dude. They done messed it up.
But they get, it's like, the emergency room in this society now is a lot of people's their urgent care, or they need a physical.
It's a regular doctor.
It's just that's how they use the emergency system to get their checkups, because we're gonna give them a full.
No primary care physician.
No more primary care. So the trauma doctors are the primary care physicians. So you get everything: the blood test, you get the check, you get the EKG, you get everything, you get the works. But they don't have any insurance.
Which speaks of universal health care and why we need universal health care.
It goes back to that.
This ain't difficult to figure out.
It's really not a problem. It really shouldn't be a problem. The only bottleneck is greed.
Exactly.
The only bottleneck is greed.